This is part 4 in a series on controversial opinions I have as an endometriosis dietitian with endo working in this space. And honestly, this is not going to be much of a video because in this one I'm talking about how endometriosis patients tend to know far more about endometriosis than their healthcare providers. It's almost like when you're living with chronic and debilitating pain and other symptoms for years, sometimes decades, you develop this new skill set that involves identifying certain triggers or irritants that you've routinely noticed trigger symptoms or pain. Many of us are also handed the same pharmaceutical options, and so over time we know what's worked, what hasn't worked, what makes us feel good, what makes us not feel so great. We're also the ones feeling the symptoms. So for example, if we know that we're having heavy bleeding, we might be able to tune into some kind of hormonal involvement with endometriosis. Or if you're routinely experiencing histamine excess symptoms like congestion, itchy eyes, rashes, hives, low-grade fever, we can intuitively pick up on that immune involvement in our symptom picture. So I guess my takeaway from this video is chart all of these intricate details about the way that endo is presenting in your body, because if you have this data, if you have this collection of data, all you need is to come across the right provider who will take all that data, interpret it appropriately, and actually offer you a solution or a strategy that may help return some quality of life.